All new on the Doctors.
It's gotten to a point that I can't take it anymore.
The 1-hour guide to a pain-free life. And want to get rid of back pain once and for all?
We have the very latest treatment. You have to see it to believe it.
And all new on the Doctors.
You want to get rid of your back pain once and for all? Well, we have the very latest treatment. You have to see it to believe it.
I've worked at a cemetery as a caretaker and gravedigger. I was walking the mower down a set of stairs, and I flipped over the handles of the mower. I hit the back of my head on the steel rack. I wake up with headaches every day, so I'm going in tomorrow to have a total disc replacement done.
Whether you're experiencing back pain, head pain, or even abdominal pain, today we're giving you all the answers you need in our 1-hour guide to a pain-free life. For Shaundra, her pain was the only warning sign of something much more serious.
I've worked at a cemetery as a gravedigger for the last 25 years. But I've been in severe pain for the last year and a half. Our cemetery's on a hillside, and I was mowing an upper plot. And I was walking the mower down a set of stairs, and the mower it took off on me. And I flipped over the handles of the mower. I hit the back of my head. I don't think I've ever hit my head that hard. It really scared me. When I went to the doctor, I got an MRI, and it showed a herniated disc in my neck. I wake up with headaches every day. It gets so bad, it's like I can hear my pulse in my ear. I've tried medications. I've gone to the hospital 5 times because of the pain. I really feel that it's gotten to a point that I can't take it anymore. So I'm going in tomorrow to have a total disc replacement done.
Well, let's see how Shaundra's spine surgery went.
What you've done is you've injured the C5-6 disc, and it's pinching the spinal cord right here. So we'll be removing all of this material and replacing it with disc replacement implants. Let's get this show on the road here. Where we're going to make the incision is just below the Adam's apple. We're going right in front of the carotid artery, and that leads us right down to the spine. We're right on the spine. This white glistening structure is the front of the disc. Now we're going to incise the disc. This is the disc material here, the white cartilage. Now I've removed the entire front of the disc. We're going to use a microscope and pull the material off of the spinal cord. This is the delicate part. Well, I can see the piece sitting right in front of the spinal cord right now. This was the piece of disc that was pressing on the spinal cord. This is the disc space. Now has no more disc in it. We're ready to put the implant in. This is the implant. We're just going to gently tap the implants into place. This is the C5, C6 disc with the artificial disc replacement in the disc space. You can see that it's aligned perfectly in the center of the disc space. It's just going to function very well in this position. So I'm very pleased with this.
I'm here with spinal surgeon Dr. Kenneth Light from the San Francisco Spine Center, along with his patient, Shaundra. Thank you both for being here. And I just want to remind everyone at home that depending upon if you have a herniated disc, your symptoms can be very different depending upon where that herniated disc occurs. You could have weakness or numbness or pain in an arm versus a leg. For you, it was really up high because you said C5-6 is where that disc was herniated, which is higher up in your neck. How are you doing after the procedure?
I'm really doing good. No headaches and can function normal.
And so, Dr. Light, let's talk briefly. When you herniate a disc, why you have so much pain in some cases, like clearly Shaundra did.
Well, what happens when you have a herniated disc is a piece of the cartilage, which is the shock absorber between the 2 vertebrae, breaks. And it usually lodges in the spinal canal against the spinal cord or the nerve root. And it causes pain to go all over your body because it pinches the spinal cord or the nerve root. The nerve goes down the arm, and you can have pain down your arm. You could have headaches. You could have numbness in your legs. You could have just about anything.
Which is why if you have unexplained pain like you had, you need to get it checked out. So what are some of the treatment options?
Well, fortunately, most people don't need surgery, and surgery is the last resort. What we do is we send patients to physical therapy, we give them epidural injections, we have them rest, they take medication, and miraculously, in about 3 weeks usually, if you have a herniated disc, the pain will go away, but not in all cases. And the cases where the patients have chronic pain, where the pain lasts for 6 months, those are the cases that we choose for surgery. The old type of surgery for this type of problem would be where the doctor removes the disc. He replaces the disc with a piece of bone and then usually puts a plate and screw over the spine to hold it still. And this operation is called a fusion. But this operation is somewhat archaic because if you really think about it, we're all meant to move, right?
Right.
And the spine was meant to move. So why should we do a fusion? Well, it was very interesting that an Olympic gymnast in Germany became an orthopedic surgeon, and she decided that the spine should move. And they developed an implant, which is called a disc replacement, that is a small bearing. It's a small joint that the doctor puts in the spine. He goes in, and he removes the herniation, and he removes the bone spurs, and then instead of putting the plate and screw on the spine, he puts this little bearing in. And as you can see, it allows the spine to move in a more normal way. It takes the pressure off the other discs in the spine. It allows the patient to move. And the patient can be functional, go back to work in 2 weeks, whereas spinal fusion can take 3 to 6 months.
Wow, this is such cool technology. Shaundra, we're so happy that you're feeling better.
Thank you.
Best of luck to you, Dr. Light. Thank you for being on the show.
Thank you.
Coming up.